the number of participants is pretty stable right now. So we can start. Okay?
Okay.
Yeah, so first of all, I want to thank you, Vale, for joining us today and do this one. We really appreciate this one. I'm, on behalf of my students, on behalf of my colleagues, we really appreciate this one. Now, why don't you take some time for introducing yourself?
So my name is Valentina Rosti. I am an emergency doctor and I work in Bergamo. If you don't know Bergamo, Bergamo is a city with 1.2 million inhabitants that is near Milan, so in the north of Italy. And I've been working in the emergency room for like 5 years, but I am specialized in respiratory medicine. And I am also a teacher of what we call non-invasive ventilation. So all of this stuff that I told you came to an help in this situation because we had this big emergency. That is a big emergency respiratory disease.
You were the best. You are the right person.
No, I was the right person, unfortunately, in this situation, because we've been treating in my emergency room the most severe cases. So what I'm gonna talk you about is my point of view, and my point of view is the one on the most severe disease. So all of my patients have acute respiratory failure. And so this is like a slice of what is the disease overall.
So basically, you work in the emergency room, so there are different cases of COVID. You work on the extreme case, the severe one, the one that...
Yes, as I'm gonna tell you later, talk to you later. We had this big emergency in Italy. So we had to admit the most severe cases, and so in my department, that is in the red zone, we call it. So the most hit area, we had to provide assistance to those who needed oxygen. Let's say simply oxygen or other respiratory device. They were the ones that couldn't cure themselves at home.
Okay, if it is okay with you, Vale, I'm gonna share a video that you posted some times ago in Facebook. So basically, let me start this one. This is a video that shows the workplace where Vale is working every day, and actually shows the actual situation. I was in Italy a couple of weeks ago. This is an interview that is being done by Sky 24. So can you see, guys, my screen? You all seen it? Wonderful. So I hope that there are not to be many technical failures. So here contains this, I want to give you a powerful images that I think, might be more worth than any words for this, but might contain disturbing scenes. So if you don't want it, just switch off the video for a second. Okay? This is where Valentina is working, and these are her colleagues, if you want.
They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here and they are in terrible shape. This is an absolute constant. This killer pandemic is virtually out of control. The patients are literally gasping for air. The plastic bubbles the staff struggle to communicate through attempt to equalize the air pressure in the lungs. Nobody expected this. Nobody thought they'd be treating so many so quickly. And it's not like flu. It is chronic pneumonia, and it is killing hundreds each day.
There are now 15 patients.
The doctors say they've seen nothing like it before, and are warning other countries, especially the United Kingdom, that they will see it as well. People who keep describing this as like flu. It's worse than that, no?
No, it's totally another thing. I think it most pneumonia, more pneumonia than flu, because most people get pneumonia, and as I said before, it's a very severe pneumonia, and so it's a massive strength for every health system, because we see every day 50 to 60 patients who come to our emergency department with pneumonia, and most of them are so severe they need very high FiO2 of oxygen, and so we have to reorganize our emergency room and our hospital in 3 levels of intensity, as you saw.
This is the main hospital in Bergamo, in Lombardy province. It's one of the most advanced hospitals in Europe. But it's the most hard hit of all the hospitals in Italy. The town is the center of the epidemic here. This isn't a ward, this is a waiting room. Wherever you go, people are on gurneys, in corridors, in meeting rooms, they're everywhere. All the medical staff urge other nations to see what's happening and lock their nations down right now or face this.
What I would suggest is just shut down to stop all the outbreak and not come in this kind of situation that is very, very difficult to manage.
Can I ask you personally what it's been like?
I never felt so stressed in my life. I'm an intensivist, and I'm quite used to, intense moment and choices, and people are critical and will die without any, treatment, and you make the difference. But when you arrive at this point, you realize that you are not enough, and maybe we are 100 anesthetists here. We are doing our best, but maybe it's not enough.
We are performing the test for the nasal swab to detect coronavirus.
The problem facing health services across the world is that when the infection curve goes up, it rockets. And all the resources, all the testing, all the supplies are used up instantly. Multiple hospitals all at once. What's staggering is that Italy is doing a lot of testing. Thousands upon thousands are being tested. So far, about 4,000, the numbers keep changing, have actually completely recovered. The crucial point is that about the same number are dying. They're sort of neck and neck. And it seems you either live and recover or you die. Something nobody expected. Bergamo wanted us to see this to show what a catastrophic emergency nobody has experienced before looks like. Here they're calling it the apocalypse, and this is what it looks like. Their message to us is simple: get ready. Stuart Ramsey, Sky News, Bergamo, Italy.
Okay, could you hear, guys?
The great fear is if we don't get our response to coronavirus right, Australia could experience the hell.
Okay, could you hear it? That was good. Okay, Vale, can you quickly describe what happened in the video?
So what you saw in the video is my emergency department. This is not an intensive care unit. This is an emergency department. But we had so many patients that were coming that there are, as the anesthesiologist in the video told you, we have 100 anesthesiologists. We are a very big hospital, and one of the most advanced in our country, but they weren't enough. So we have to reconvert our hospital. And what you see in the video is a room that is usually closed because this is for mass casualty events. So when you have a bomb exploding or something like that, we are prepared with this room that has 20 positions where you can put oxygen for the patients. And we had to open it and keep it open, and it is still open at this time. And then you see all the halls and all the waiting room, where we're seeing with the patients, where they usually we have patients waiting for the exam, for the results. We have to convert all our emergency department in a big ward with different level of intensity.
Okay, that is, I think, I mean, something that would be very useful, since, you know, the United States seems that they are lagging after Italy, but it's gonna come also here. If you could describe the timeline, basically what happened from the first case. So basically what we got from here is that basically there has been a reaction and was fast, you know, there were tons of testing and etc. Would be useful, like from the first case, how you started organizing inside the hospital in order to face this, and basically how was the situation, say, a couple of weeks ago during the time of this video.
So we had our first important case in Italy. It was the 21st of February. It was a Friday. I was ending my night shift, and this first case wasn't in my hospital. It was in a city that is not so close, still in my region, but it's like 100 kilometers away.
Was an
so
old
no, it was a young guy. Was 38 years old. He had no comorbidities, so he was a healthy guy, and he was an athlete. So this was quite a shock for us, because it wasn't a mild case as you expected in a young man, but it was a very severe case. So he had to go to the intensive care unit. He was intubated, and he was kept alive by machines for like 2 or 3 weeks, because this disease takes a lot of time to heal. And so this was a shock. And the day after that, or the same day, the government reacted immediately, and they isolated the hospital of Codogno, the city that I'm telling you about, and isolated all the cities around Codogno. And they isolated also the hospital of Codogno. So nobody, nor the doctor, nor the nurses, could go out or in from the hospital. And we thought we were good. I am gonna say it, I'm gonna be honest. And we thought, okay, this is gonna work. And my hospital started to prepare, because we thought, okay, somebody's gonna come, because this guy has met somebody in the last days before he got sick. So we expect some patients. So we started immediately to allocate the resources to coronavirus patients. So we had like 20 beds in the we have the infectious disease ward that were dedicated to coronavirus patients. We had 3 intensive care beds dedicated to the intensive care unit for coronavirus patients. And all our paramedics, our system, were instructed not to bring the patient to the emergency room, but directly to the ward, so to avoid every contamination. And so it was I guess, Sunday after Friday, first cases. On Sunday, we were ready.
So the 25th of February.
Yeah, that we were ready, and the government has already closed. And the government started also to close all leisure activity, I call them like that, like the gyms and the spas, and everything was already closed. And we thought we were good. And the next week, in my hospital, some patients...
Just to make sure that I have all the timeline on. So on the February, there is the first case. There is a reaction from the side of the government, starting basically isolating the hospital, etc. And there is an internal reorganization inside your hospital. What you're doing, basically, you are separating clean cases from COVID cases. And basically, you start devoting, if you want, a special entrance to COVID cases, such that, and you were working on these units, so you start to suit up or something like that?
Yeah. We were already, on the when we heard the news, we were already suit up in all the emergency department, wherever you was. You had to suit up, to put your mask, your glass, and everything.
So you were...
And
at that stage, so that weekend, did you receive any patients?
zero. I was on my shift on Sunday.
Okay.
First case is Friday. My shift was Sunday. I was all stood up, and 0 patient came, and I was obviously happy because we were expecting something bad to happen, but it didn't happen immediately after that.
So what happened the week after that?
Yeah, and then on the Monday, we had our first, the night between Sunday and Monday, we had our first patient that was very serious, very severe. And that came from another hospital near that is a smaller hospital. And I'm telling you this because later I'm gonna tell you what would happen in Bergamo. And, but on the next week, we started to have new patients arriving. And we decided that every suspect had to be put away. So we admitted all the suspects of coronavirus at the time. And we started to reconvert the hospital with dedicated wards. And we dedicated one small room to isolate the coronavirus patient, because the most important things in this epidemic, in all of this infectious disease, is you have to isolate and cure him and make sure nobody else, and also that healthcare personnel doesn't get it, so it doesn't spread. So we had some beds, like 20, 30, 40 beds in the first week dedicated to these patients, and one small room. Then during the week, the room became a little bit larger, but we still were good. We could manage it with our resources. Okay. And we are coming to the end of the first week, and it was Friday, so 1 week exactly after the first case in Codogno, and we have our hospital is quite big, my Bergamo Hospital, because we have one of the biggest intensive care units in Europe. And so we have everything, but we also have another hospital in the valley that is another part of our hospital. Yeah, this is a part of our hospital that is very small. It's in a village in the mountains, so it's like for patients of the valley, and that don't need many assistance. If they need something more, they are transferred to our big hospital. And we got a call on a Friday evening from our colleague in the valley. And he told us the situation here is out of control. In my little hospital, I have a lot of patients that require respiratory assistance. And obviously you can provide what you saw in the video in a small hospital in the mountain. And so it started to become very serious. And in the meantime, I was answering him, okay, I'm gonna come up to you, and we're gonna face it, and we're gonna see what we can do. And in the meantime, the patient started to arrive all at once in my hospital in Bergamo. So the situation changed in a little time. From
a week from the first case. Basically,
yes.
The first case was on Friday, this 21st. During the weekend, you just shut up, no one was there. After 1 week, there was this case in the branch, and this was the first alarming case. The first small hospital were congested at that point.
Yes.
But you still have capacity. So what did your hospital started doing there?
We obviously transferred all the patients from the valley to our hospital to give them assistance. And we, in 1 night, we had to reorganize completely our emergency department. And so we dedicated I'm gonna show you, can I show you my screen?
If you can, yeah, absolutely.
I try, I hope I can do it.
Don't worry.
Okay, do you see?
Wait, I think it's coming. Wonderful, we can see. This is your hospital.
Okay. So this is my big hospital, and as you see, it's very futuristic, and this is nothing like the big hospital we have in the small hospital we have in the valley. And so I just wanted to show you this. if you are able to see it. I'm not very good.
Yes, we can.
Okay. Okay. So this is how was my emergency department before the epidemic. And I'm not going to enter into details, but we had one room, shock room, that is the room for trauma. We are a trauma center. We are the regional pediatric trauma center. So all of the pediatric patients from trauma come to our hospital. We are the referral for myocardial infarction, for stroke, for intracranial hemorrhage. So a lot of things. So this is to tell you that what you saw is a big hospital, it's not a small hospital. Yes. And we had all of these beds, all of this world, and if you see, this is before and this is after. And if you see it, this is all COVID. So we had to dedicate, everything was reconverted to COVID area. So we were COVID intubated, COVID intermediate, what you saw in the video, COVID ward, COVID observation, COVID that could walk, COVID horizontal, so that they are laying in the, and they can't walk. And so obviously there were also clean pathway for patients without coronavirus that unfortunately were very, 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 very few patients without coronavirus at that point.
Okay, so basically this one, just to make sure that also my students are following, on the top left-hand side, you have the structure of the hospital, where basically the hospital has some room from COVID that has to be isolated from the clean, which are all the other type of disease. And basically in the matter of one night or a couple of nights, a huge organizational effort that puts basically devoted the entire hospital to COVID.
Yeah, we had to define the emergency room was completely changed in just one night and one day. So we had to.
What happened after that? Well, so
after that, so after that, we started the real fight, because the week after that it was as they say in the video, it was the apocalypse. So the patients started coming, but there were. My chief described them as an earthquake, because you have this like 100 patients, not at the time, obviously, but one another, and they are very severe, all very severe. So they all required assistance. So the hospital put all of the effort to reconvert new area, and the intensive care beds were reconverted. So we had 80 intensive care beds. That are really a lot. So you have to imagine that an average hospital, I guess also in the USA, a big hospital has like, if it is very, 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 very big, it has like 20, 25 intensive care beds. We started with 80, and we had to convert all of the 80 intensive care beds to coronavirus patients. And we had to add some more. They weren't enough. As you saw the anesthesiologist in the video, and this was really terrible for us, because you had the feeling that you couldn't provide all the assistance you wanted. So we continued to reconvert everything we could, and so we went to the surgery room. You say that?
Yeah.
So we took because we didn't have enough ventilator, respiratory machine, the things that they put you on when you are going on a surgery. That is the thing that keeps you alive in this situation. So we closed everything. My hospital was very, really, I guess, a good job, because we closed everything, all the scheduled surgery, all the visits, only the things that were urgent were kept. So you could still provide chemotherapy to oncologist patients and the essential cure, but you couldn't provide all the other things. And so we took oh my God, sorry, it's ringing. Okay. And so we took the respiratory machines from the surgery room, and we took them to the emergency department to have more and more ventilators. And so this is how it was for like the third week and the fourth week and the fifth week.
Okay.
And the other thing that was very, sure.
So something, because I mean, here, I think it's clear from here there has been a huge reorganization from clean cases to COVID cases in terms of bed, materials, and if you want, how about skills? Like all doctors were able to operate these machines? Like if I am a gastroenterologist, can I operate that machine? Do I know how to do that?
So this is the other problem. This is a really good question, because I am telling you about my emergency department, but also the hospital has to reconvert. And so they reconverted my hospital like 400 beds to coronavirus patients. And like more than 100 of them needed the balloon that you saw in the video. And the balloon that you saw is called CPAP. It's a continuous positive airway pressure, and is something that we use to keep the patient alive. I'm gonna make it simple. And to operate those balloons, you need to know respiratory physiology. Okay. But so you would say you need like 50 pulmonologists to operate them, or intensive care personnel, or emergency room personnel, and obviously we didn't have all of this stuff. So my hospital started to train all the other doctors, so internal medicine, so gastroenterologists, so neurosurgeon, everybody was trained to use them. And we put one pulmonologist and one anesthesiologist. We called them from their home. My hospital called anybody that they could, and that they were outside, they worked outside, and with their heart, they came to help. And so there were these gastroenterology for like 20 patients, and also one anesthesiologist and one pulmonologist that's like a supervisor for them, to help them, because they had to train very fast, but it's not so easy, obviously.
Okay, so if I understood correctly, so it was not only scarcity of resources, so in terms of these balloons, plastic balloons, and etc., it was also scarcity of human capital, because this is something that might be relevant, I think, for the United States. You know, this retraining is something that can happen now, or other countries, because my students are actually from all over the world. So this is something that should happen at the beginning. So, okay, Vale, I think, I mean, let's actually move to a comparison with the United States. So this, I think, would be actually a good point, except because, you know, from the data, my understanding is that really we are lagging behind. There were some policy that was saying, you know, the United States will reopen after Easter. I think the outbreak is going to be in Easter in the United States. So can you provide some comparison, like between?
Yeah, sure. I'm going to show you. I'm going to share my screen again. Okay. You see it?
Yeah, we can see. Yeah.
Okay. So this is I took this data yesterday. So this is Italy. Okay, these are the cases now, and this is the United States, as I saw on the Johns Hopkins Center. And so this is the data that I have, and so I took the curve of growth, and this is a graph. You are certainly better than me with graphs, but they put the 0 point in like 200 cases, and they saw how it's moving, the growth. And so you see that China is like that, and Italy is like that, and USA is like that. So the growth is very important in the USA. Certainly the USA has really a population that is bigger than Italy.
So this one, you know, these are absolute numbers. So the United States is a bigger country, but what is really the growth that is the something that should be addressed.
The growth is important. So obviously, in a big country like the USA, it's normal that it's different, but they are growing. And what you have in the USA that we don't have is the number of critical care beds per capita. So for every people that there are more intensive care beds, and this is the one that you are gonna need for coronavirus. And this is a good thing for USA.
Yeah.
But because I can show you this is how many patients require the intensive care unit. So of the 100 that I showed you in Italy, there are like 4,000 that are in the intensive care.
So just understand, this one basically out of the 100,000 cases with COVID,
yeah.
basically this is the 4% is around the one that needed this intensive.
Yeah. You can see it here in the epidemiology that there are a lot of people that require the intensive care. So in the USA is more ready in this from the hospital point of view because of the big number of intensive care beds, but they are growing fast, and this might be the problem.
Okay. So now I think maybe if you can tell us a little bit about this virus. Is it like, because you know, if you listen, so I think, okay, let's wrap up. Something that I think we got from here is that, you know, some of the politicians mentioned herd immunity, so get, you know, a sufficient part of the population infected, or etc. Do you think that one would be a viable policy for hospitals? Would be, you know.
I'm gonna tell you my point of view. That is the healthcare point of view. I can't say anything about economy or politics because I don't know nothing about economy. But from my healthcare point of view, as I showed you, the disease is really severe. And if you look closely in the video, you saw this balloon and you saw the people in the balloon, and they are not all the people. And this is the most important things, not because all people are not important. That's not a message at all. But this is to tell you that the coronavirus can be severe in everybody.
Yeah.
Most likely in older people. And so the people that need respiratory assistance to survive are going to be a lot. And the healthcare system can't manage all these patients at once. So all the measures that are taken are to flatten the curve, we say. So they don't come all at once, but they come in a way that you can cure them all. Because if they come all together, there is no way any hospital and any country can take all this patient at once.
So I think a good message, just to sum up for my students, is that the real problem is that if everyone comes at the same point, there is scarcity of two basically factors: human capital, skills, people that are able to operate these machines, and physical capital, so actually technical machines that allow. So herd immunity does not take into account this problem. So you have, at the point, you have to select people who die. You have to select the young for the old, or start choosing who to save. That, I think.
No, I have to say another things, and it's something that I saw, so I'm telling you my point of view.
Yeah.
And in the first week, started to came the elderly. So we had patients that were like 19 years old, and then 8 years old, and then 17 years old, and then 60 years old. And in the last weeks, we have had patients that are really, really young, and they are really, really sick. So another reason why I wouldn't think this is a good idea is that this disease is very, 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 very strong. Also in the young. So if you want to go for the policy where you let the virus spread and you get an immunity, you have to take into account that you are gonna have lots of people that will die, and also young people. And when I say young, I say like 40, 50 years old. And for me, 40, 50 is very young. They are certainly less vulnerable in terms of respiratory system. So not all the 40 years old that get the virus are gonna be so sick, and we're gonna see. But there are some that have no comorbidity, like the case 0 that we are talking in Codogno, the 38 years old, health, young guy.
It was very, yeah. So another thing that you hear is like someone discussed this one as a flu. It's not a flu, right? If you can, like, you know, make this concept clear, and in particular is that, yeah, if you can basically discuss a little bit what is this virus.
Yeah, so I'm gonna show you, these are the symptoms of the virus, as you see here.
Okay.
And one of the most important symptoms is certainly the fever.
Okay.
But not also the fever. There are a lot of symptoms, and this makes it really hard to know if you have coronavirus or not, because you can have diarrhea, you can have nausea, you can have vomiting, you can have abdominal pain, and you can also have cough and fatigue and shortness of breath.
Okay.
And so I took this. This is the World Health Organization, and it's a bit small. I hope you see it. It divides the clinical syndromes associated with COVID, and the most people get this mild illness.
Okay.
So there are, especially the young people get this mild illness. Then it may be like a flu.
Yeah.
The mild illness may be like a flu. So you have high fever, and you have you lost the sense of your taste and the smell. This is about quite characteristic of coronavirus, and the most people are here. And then there are people that can get from here to here, and when you go here, you have pneumonia. So you are gonna need supplemental oxygen. And then you can have severe pneumonia and all this horrible syndrome that are the one that you saw in the video. So the flu, we have a lot of flu also in Italy, and the virus doesn't act like that at all, because you can have pneumonia related to the flu. Yeah. And in 2009 there was the H1N1, you say also in English, I guess, and that was a flu virus that was very eager to cause pneumonia, but not as much as this SARS.
Yeah, so one is just to make sure you take care of the cases below pneumonia, right?
Yeah, yeah. I am from here to here in my hospital, my emergency department. We see somebody with this, we also see it, but they are cured on the territory. Okay, they don't come to the hospital.
And the second question has to do with actually with the previous slides. You mentioned there are so many symptoms. So understanding is that is difficult to detect. How does this different to the existence the SARS, the virus that was?
Okay, so the SARS, this is it's the same family of coronavirus, SARS, MERS, and SARS-2, that is the novel coronavirus or COVID-19. It's different because the SARS had a really higher mortality, but it also was less eager to spread.
Nice.
So it was confined. You say we didn't have any SARS case in Italy. And also I guess there was less people that were asymptomatic. So all with small symptoms. So if you have a disease that can cause small symptoms like this, that can go from small symptoms to disaster, it's difficult to detect the one with the small symptoms that are going around and they're going to spread it. So this is, I guess, the difficulty we had with this virus and why we didn't saw it coming.
So paradoxically, worse viruses like SARS with higher mortality had that lower effect in terms of infected and maybe dead people, because the problem with this virus is that it's difficult to detect. There are a lot of asymptomatics, and that is something. Actually, this is something very good I'm going to post for my students. I'm going to post a video in YouTube of a guy basically that does some simulation that shows how just by affecting the difficulty of detecting, they put in some probability of making the mistakes in detecting the cases, how this one affects the total number, the cumulative number of cases that get infected, of which eventually you have to take a proportion that are the people that die. Okay, so why don't we move actually to the spread? Because there is actually, there is actually an interesting question from one of my students, Ursula. She was asking, beside, washing hands and social distancing and etc. So how does this virus spread, and what are the things that we have to care about?
So this is the CDC. That is the most important authority, I guess, and it confirms that it spread person to person with these respiratory droplets. And so if you are within 6 feet, but I think I would say a lot, I would augment the distance between people. You can get it because when you talk, when you sneeze, when you cough, you are spreading these respiratory droplets. And this is the main way of transmission. There is a big question of if someone can spread it without being sick, and we think that the answer is yes, absolutely, because we saw it. We saw a lot of cases where they didn't meet anybody that was sick, but they were sick, and it can spread from contaminated surfaces. And I found this. This is in Italian, but I can translate. About how many times does the coronavirus remain on the surfaces. And this is copper. In 4 hours, we don't have it anymore. This is a paper sheet, yeah, 24 hours. This is steel, 38 hours. And this is plastic, 72 hours. So it's very unlikely to get coronavirus from the surfaces. If you go to the supermarket and you're doing your shop and you get home, it's not so likely that you're going to get it from the plastic bag. But I would suggest to wash your hands. They are telling you, I guess, everybody's telling to wash them. But this is very important because the beautiful thing about this virus is that it's very easy to eliminate it just by washing and disinfecting it. So you can disinfect your stuff with what you have there. And when you are sick, the most important thing is when you are sick, you have to stay at home. You don't have to meet anybody. Also, if you have a sore throat in this period, because I think you are young, your students are young, and so the youngest you are, the less symptoms you have. So one of the biggest reservoir of the virus are the children, because the children, fortunately, and this is really a fortune, they rarely get bad cases, and but they are healthy, they are good, but they bring it around because obviously children can't have all the hygiene measures that an adult can have, so they are spreading it a lot. So I'd say you have to be careful to your hygiene, personal hygiene, and also to be careful not to go around if you have any symptom during a pandemic. You have to be very careful to these things.
I think this one, the fact that the children were spreading this virus might have something to do with the fact why Bergamo was hit so much, maybe together with integration, the fact that, if I have a kid, I bring to my parents.
This is there are a lot of reasons why Bergamo. I am still asking myself why Bergamo was so bad, because and we still don't have an answer, because we still can't believe it, I think. But one reason is certainly because in Italy you have this family, especially in the valley around, where you have this big family where there are children and there is the granny and the grandfather, and so the parents go to work and the grandfather is watching the children. But and this might be the reason why so many old people died in not the only reason, obviously, but why there was this pride in the old people, and where they got it, because if you have children, you are not gonna see the same symptoms of coronavirus in an adult. This is not the only reason. Obviously, in Bergamo there are a lot of different reasons that we are supposing that caused this this tragedy, I would say.
And how is the situation now in Bergamo? It's like,
So
yeah.
Yeah, okay. If can I show you a video if I can? I have it ready. Yes. So this is this is Bergamo. Bergamo is a really beautiful city.
By the way, we have a little lag, Vale. At least I have a little lag. So far we are still seeing copper.
Okay. Now, are you seeing it or not?
No, we are not seeing yet any video. We are seeing basically copper, paper sheet, plastic.
Why?
Are you all seeing that? Yeah, I think there is a little bit maybe of delays, or if you have two monitors, maybe if
no, I have one monitor and I'm seeing the channel. You still see copper?
we still see copper. How about you minimize the slides? If you press and basically you send it away, I think that one might.
Okay. I know what happened. Sorry, I'm gonna do it again.
That's okay.
I'm not very good with this program. Okay, so I think now you are seeing it.
Yeah.
YouTube?
Using another.
Okay, so it was my fault. Sorry. I'm gonna show you this video. You hear it?
Yeah.
Okay. You hear me? Yes.
Yes.
Okay. So I showed you this video because I wanted to show you a lot of things. And this is Bergamo, what you see in the video. And Bergamo is like we Italians are people full of life, you know it. And we are always around. We do a lot of stuff. So Bergamo is a very, very, very vital city. And this is Bergamo now. This is what is really a real lockdown, because we are locked down completely. We can't go anywhere except for to buy food, because food is always provided. We can go to the pharmacy, and we can go to the hospital. That's it.
No jogging?
We can. No. We can no jogging, no walking, no going outside, unless you have a physical conditions, obviously, that require to go outside. And So this is what Bergamo looks like. The streets are empty completely, and the patients are inside the hospital.
It's been for how many weeks? For a couple of weeks now, right? 3?
It's been, I'm gonna show you the timeline. Okay, so this is what Italy did.
Because just to give you an idea, basically, Boulder resistance started basically last week with a lockdown, which is a partial lockdown. I know many other cities in the United States, there are actually states that instead, you know, they are even considering it. So the timeline actually could tell us, you know, something that is informative.
This is from the Imperial College of London. Yep. This is the timeline of Europe, and this is where we ordered this is the March. Yeah. This is where the school closed, and in the beginning there was the government invited us to stay at home, and here on the 11th of March it was ordered to stay home. So we have the military people in the streets. They are checking if where are you going, and they are checking if you are quarantined because you have the virus and you are not in the hospital, because there in Bergamo we have so many cases that there are no hospital to admit everyone. It's impossible. So you are ordered to stay at home. There is the police is checking. They are calling, they are coming to your house, and they are checking if you're home because you have the virus and you go around. This is a penal, you say.
Violation of the penal code. Yeah.
Yeah. Okay. And I would say that the people in Italy asked for the lockdown. It wasn't imposed. The government ordered the lockdown, but the people were asking it because in Bergamo we had Bergamo. I told you it's 1.2 million people. We had estimated more than 4,000 deaths, and all of my colleagues, the doctor and nurse, and I'm not from Bergamo. I'm from Milan, and I live in Milan. But my colleagues that are from Bergamo, and Bergamo people are amazing people. They are resilient. They are real fighters. They all have one friend, one cousin, one dad, one brother that died from coronavirus, and so they were the first to ask, please do something, because this is so out of control that we are all gonna die, and our family, our grandfathers are dying, and they are dying alone because the awful thing is that you can't come to the hospital to see your father or your sister if he is in the hospital for coronavirus because of the isolation.
So you cannot assist them.
No, you can't assist them. And these people are dying alone, and this is this is terrible for us, and terrible for them, terrible for the families. And so it was so difficult and so stressful for them that we needed this. And with this, I'm gonna show you the.
Yeah. So actually,
now.
The question. So, is this working? Shall we conclude with a positive message?
Okay. So I can't say if this worked because this is too early, and I'm expecting it to start again in a while. I read today on the news that Hong Kong, after the quarantine, they started again to have some cases. So I am very worried. But this is China, and this is us in Italy. So this is the percentage of the cases day by day, how many they augment from day to day, and
after
we are going down.
March that you showed before, when there was the lockdown, it started going very fast.
Yeah. You have to wait 2 weeks to see the effect of the lockdown because there are all the incubation and so this is the Imperial College, and that they estimated that the lockdown we prevented 38,000 of death in Italy. This is just a curve, an estimation. I don't know if this is true.
So if we had not done this lockdown,
we would have this number on the 31 of March. We would have 5,200 of death. And with the lockdown, we had like in Italy, I'm talking about all Italy,
And just for my students, what she's mentioned, so this is a model that basically has 14,000, they estimate basically the total estimated death, and then is saying what would have happened if we had not done the lockdown. Then there would have been like 38,000 more people that are dead. As economists, we make assumptions. So what you have to look is if this assumption are credible or not, but this provides us an idea of what would have happened, so how good it was. Okay, this kind.
And the last thing that I can tell you about how good it was is that I took 2 pictures today at work, and if you remember the video in the beginning,
yeah,
with all the hall full of patients, this is today, and I can tell you that this is my emergency department today. So at least the waiting room and the hall there are no patients. The patients are still there. Obviously, they are inside where they should be in the wards, in the ICU, but they are not everywhere as they were before. So this is a good sign. I'm not telling you that the problem is solved at all, because we still have a lot of cases and we are still in the middle of it, and we don't know what could happen when we don't have anymore the lockdown, because when they're going to reopen, I don't know how it can be done. But this is certainly a little bit better than what you saw in the
So
video.
do you have a message like that you want to, like a final message you want to give to the students, and then we go to a brief Q&A question? Something like social distancing, we have to go to a lockdown, or?
Yeah, no, the message to your students, because they are younger, is that I know that it's not easy to be away from your loved one, from your friends, and to stay at home. And this is heavy for everyone. And this is heavy for us, that healthcare workers, because we have to isolate from our families, because we are potentially carriers. And so this is hard. And I know, so I know it. I am experiencing it. But if you are young, you are really, really dangerous, because you might have it and you might be asymptomatic. You might not have any symptom, and you may not be the one that are gonna get this serious disease, but you might give this to your friends, and you might give it to your oldest friends. I think every one of us has a friend that is older than us. And also, you don't know what disease can your friends have. So maybe your friend has immunodepression, maybe he has a respiratory disease, and you don't know it, because not everybody is going to tell you about the diseases. So it's very, very, very important that in this situation, my chief, my big chief, is going on the TV and telling nobody has to meet anybody. This is our motto now, because it's the only way in this moment to stop the spread. Yes, to stop the spread. This is just a phase. I was telling you, this is the first phase when the disease is spread like that in a pandemic way. The first thing is you have to stop the spread. Then you have to change all the measures, and there are going to be a lot of things that will be done to stop it, because you can't be locked down forever. I know, and there isn't a vaccine, so the things are going to change. But now the most important thing is that you stay at home.
Okay. So if Connor, Jonathan, and Vincent, they must have collected the questions over this time. If basically you can what are the questions that you think might be relevant at this stage, and then we give some time also to the faculty. We are going a little bit over time, so if you want, you can leave the conference, but we keep going.
Okay, so one of the good questions we found had to do with the number of cases, how it's changing. So the question exactly is, it looks like the number of newly positive cases in Italy is pretty steady. So do you think this means that social distancing measures are working, or does this just reflect a limit in testing capacity?
So the numbers you saw are the effect of the lockdown, because increased the number. Actually, we increased a lot the number of testing in the last days. But we are not looking exact at the new number of cases to say we are doing good. We are looking at the number of people admitted in the hospital. That is a better sign of how the disease is going. And it's going down, So this is working. The problem with the testing is a big problem, I think, in all the world, because we don't have enough testing, and also the test that we all use in the world is like 70% true positive, but there is a 30% of false negative. So it's not perfect, this test. So what you use to see that this is going good is the number of patients in the emergency room, and I showed you my hall, and the number of patients that are admitted, and they are going down. So I think that the lockdown worked, but it cannot work if you don't meet anybody. It's obviously that the number are going down.
Okay, and related to that, when do you think, what's your opinion on when we should be getting tested if you have some sort of symptoms?
So this is different in every country. The most important things is not if you have the fever at all, but if you feel breathless, because the big issue with coronavirus is not the coronavirus per se, but it's the pneumonia related to coronavirus. So if you just have the fever in Italy, I'm telling you, in Italy, if you just have the fever right now in the pandemic, you are not tested. But if you have fever and you are breathless, you have to get tested.
Okay.
Other questions from the students?
We could go through one or two more, I suppose, if we have some time.
I'd like to answer one of the questions that is basically the one of Carabinieri. Vale basically asking whether the Carabinieri are enforcing the lockdown, because, Italians have been under, some noble or aristocratic since ever. So we are not so sensitive to the presence of the army around. So like Carabinieri, police, etc. If you can describe, actually now is the lockdown is enforced even by the army, not only Carabinieri. Carabinieri will look like police. We are talking about the army that is around. And also in the hospital where Valentina is working, now she can go, there are actually the army that is helping, like a doctor in the army that are helping. But this is something that is going to be difficult in the United States. You have a different sensitivity for the army than we have, I guess.
No, but as I told you, we are not scared from the police in the streets, but we are great to the police in the street, because they are doing a good job, because they are very kind. We are not in a war, obviously. They understand what we are going through, and they're trying to help us. So the army sent us some doctors, some great doctors. Also emergency, all the association helped us, and we have this police in the street that stops you and asks you, where are you going? But they are not rude to you at all, because this is very emotional for all of us, and they are so we are working together. I would say we are not seeing them as hostile.
Okay. And okay, if there is any question from the faculty, like Martin, Carlos, they are the ones that I can see here. I cannot see all of them. Any question?
I would like to ask a question, if I could.
Yep.
So the question I have is, there has been a lot of talk recently in the US, including from the Dr. Anthony Fauci here, saying that there's going to be a second wave. Perhaps in the fall, there will be a second wave. what do you expect in terms of a second wave? Do you think it will be necessarily smaller than what we have now? Do you expect to have the same kind of crowding out of your facility sometime in the fall, or do you expect a much more manageable number?
This is a really, really good question. We are talking about it also. So this is a new virus. We've known it for 3 months. So we don't know if it's sensible to hit, first of all, because we expect it to go down in summer, but we are not sure. And we are also talking about a second hit in the fall. But the thing that can change is that there will be more people. We don't know if the immunity is gonna be forever, if you get it. They are still studying it. They are saying that like for 1 year you're covered. So if you have more people that cause the disease, the disease is gonna spread a little bit less. This is the first thing. And the second thing is that I think that we in Italy, we are not gonna go back to a normal life for this year. And so what the important thing is that we are now more able to see it, isolate it, and cure it. We hope it. Cure it. We still don't have the right medication. But if there is gonna be a second wave, I hope we are gonna see it immediately and isolate it immediately and contain it in a better way. So this is like what happened with China, because they had the SARS in the 2003. So they had all the equipment ready, and so it was a shock for China, also coronavirus, but they were ready. We were not. We never had a pandemic disease in our country.
Okay. So I think, Vale, we would like to thank you for this. We really appreciated that. I will also add that, you're like kind of a little hero, and there are a lot of other heroes like you that at this stage basically are fighting for us. When you go around, you have to think about not only yourself, but the fact that there are these little heroes that every day are fighting against this virus and are susceptible to the virus. Not all of them are young as Valentina. Many can be 50, 60. Maybe they are, scared of infecting themselves and their partners. So we really appreciate your work with this, Vale. So thank you very much as Italian, as Spanish, and etc. Thank you very much.
Thank you.
Thank you. Okay, thanks to all of you for participating and showing the interest. And yeah, take care, stay safe, don't go around. And I think we got the message. Thanks.
Thank you.